So predicting the future is not a magic, it's an artificial intelligence. So I will be talking about the UKR and the active robotic, especially in TK. The debates are endless. What is the aim of surgery when we talk about unicondylar? It's a tissue-sparing surgery. It has to be. Restore native kinematics. Most important, internal alignment of the components and prevent loading of all other two compartments. What problems we face when we do a manual surgery? We cannot plan. See, we all agree that uni is just a bony surgery. The only soft tissue that you are allowed to touch is a meniscus, with a prerequisite that all 4 ligaments are normal, we are going in. So there is no question of balancing anything like in TKR. Precision, we are expecting. Preservations of bone and soft tissues we want. And preference selection we don't have. We have to start with tibia or we have to start with the femur. We don't have that choice. So the technology must give us preoperative planning. Concert kinematic, I will just show you what is concert kinematics. And we really want to create a space without a spacer. After cutting and measuring is bad choice. You must know the space without a spacer, and you must have a captured clarity that we will go through it. So actually we are moving from robot to cobot. It's a collaborative robotics. When the robot is working alone, it is called as robot. When the human and robot are working together, they should be called as cobots. So what is concert kinematics? This is the X-ray we want to see every single time when we do the surgery, but unfortunately with manual this is not possible. Number one, I want to have a very strong foundation of bone. I want to preserve the tibia as much as possible, and then I built my house on it. So largest and thinnest tibia I want. I want my medial collateral ligament absolutely in a natural kinematic tension. I want my components to be aligned absolutely as I had planned. And I want the functional auto alignment through the procedure. So maximum congruence without edge loading, and that is the internal alignment. So AI, it has to be accurate. So I would like to add one point in debate. If you want to fly, you have to reach the airport before. There is no choice. So you have to spend time. So there is no excuse like spending time before surgery. So this is the advantage of image-based accuracy is absolutely good. Auto segmentation takes 10 minutes. You will have a 3D model, and then you can execute whatever you want to see on the 3D model, your implants, your placements, you will have a preoperative reports. See, the 6-axis robot is going to check itself very honestly. There is no error. It's a self-calibrating robot. It will do its job. You don't have to. It feels like a robot in the operation theater. So if you see the cuts, the struggle, the things we are going through, the saw or burr, see, this is a miller. See, it's doing its job. It's not your job. Your job is to apply mind. So it is going to do everything for you. It starts with the femur or tibia, whatever you want to do. It will do the entire distal cut for you. It will do the chamfer. And not only that, the most tedious job, all agreed, is to create a lug holes. So most of the robotics are cutting only surfaces. Here you will have auto peg holes or lug holes done by the robotic system. So it will do its job very nicely, and you can see there are no retractors you need to apply. It's cutting tibia very well because it's very safe to do that. You don't have to worry about because you are always inside the boundary. So only thing that you do as a surgeon is just to remove the meniscus carefully, and your job is done. So this is the report you will see on the screen, that you know the maximum laxity, safe resections in small bones of our Indian patients. It's a software that aligns everything for you. You just need to internal or external rotate the femur, see the tibial slope. You just see the minimum poly because you are not over resecting. Constitutional or functional alignment is automatic, and you can check your own honesty on the table. So captured clarity is that. So data, you will have RMSE, safe. Auto segmentation is quick. Anatomical landmarks are customizable. Planning is safe and quick. Safe implant position is auto login, means it's auto aligned. You don't have to apply your mind for that because it's a bony procedure that you have done outside. Robotic calibration, again, itself. Point registration is very safe and quick. There are very less points. Pin-less connect. Most of the time it is criticized. You need long pins. You don't need pins. You just need a clamp, and it is inside the wound. Now final verification, more automation, more precision you need. You are good to go. Tool path, it always showed a tool path also. You can select a preference, tibia or femur, whatever you want to start with. It will cut the total surface along with the peg holes, and it is auto haptic. So if the bone moves, it stops. So there is nothing like your hand needs haptic. It's a robo knows its job very well than you. And along with that, you need a good implant always because you are concerned with the wear all the time. And the congruence without constraint is always the idea in unicondylar knee replacement. Thank you.